Hi everybody, it's Gerard, and today we're undertaking another episode of State of the Union. With me is Gabe Kavanagh, who is the Secretary of the Public Health Division, and Lauren Hutchins, who's Assistant Secretary of the Union. It's an important message that we want to be talking about today. It's about where we are actually up to and where the State of the Union actually is. So I guess we'll start to kick off along the lines of what's going to be in your inbox very shortly is a survey that we're putting out. And Lauren, you want to take us a little bit through that?
Yeah, so we're pulling together a member survey just to get feedback from everyone about how members see that we're tracking, testing out the services that are available to members, and also trying to get some ideas about new things that we can offer members. We're a big growing organisation, and one of the important parts of union membership is those benefits that we're able to pull together as a result of being that big. So it's exciting. It's really important that members are really honest about their feedback around the things we do well, the things we could do better, and the ideas that they have about our union moving forward into the future. So hopefully that'll be out very shortly.
And one of the important questions in that, and I know Council's considering at the moment, is ambulance cover. Do you want to talk a little bit about that?
Yeah, so currently one of the fantastic benefits that we have for members is free ambulance cover for those members who don't have their cover themselves. We want to hear back from members about whether or not that's something that we can expand for partners and dependents. It's just when you're in that situation where you need an ambulance, knowing that your union membership covers you is really important. If we can extend that to people's families, that's just a great thing to be part of the HSU.
Fantastic. And Gabe, there is a 4% increase coming?
Yes, there is. HSU members who fought really hard for a decent pay rise are going to get their second pay rise coming up in first full pay period after July this year. So people should keep an eye out. We have just seen, Gerard, that there is a delay on the payout of ADOs. So people should also keep an eye on their inboxes to get more information as that comes to hand, because the payout of the ADOs is going to be a little bit delayed.
And I'm sort of mindful at the moment that not only the 4% is coming for our public health members, we've got Allied Health Award reform, which is getting to that critical stage. Now, they'll still receive the 4%, won't they?
That's right. So we've got some really hard-working delegates at the moment who are pulling together their witness statements for this incredibly exciting Allied Health case that's going to kick off in November. That hard work is going on, but it doesn't mean that the pay rise that Allied Health members and all HSU members fought really hard for won't come through. That is going to come through this year. But there's a lot of hard work going into that big Allied Health pay claim of around 18% pay rises across the board.
And I think, Lauren, it's important for the members to understand that this has taken some time, but this is such a big case, an important case. And Council's just endorsed an expenditure, an interim expenditure, but a long-term expenditure as well. So do you want to tell us a bit about that?
Yeah, so it's am I allowed to say how much?
Yeah,
okay, good. Yeah. Just checking in. So Council's about to approve an additional $1.2 million spend for the case. This is on top of the money that's already been spent in terms of preparing to get to this point. That money goes into getting some very smart barristers and lawyers to assist, but also to get experts in the field of gender undervaluation, the economics of health, all of those professions that are being reviewed, to put forward a case to the Industrial Relations Commission to make sure that we've got the strongest case moving forward. So yeah, it's a lot of money, but it is so incredibly important. And I think you say it best, that this is a once in a generation opportunity to actually make these changes. We have got this chance now, we've got to do it right. So that money is really well invested. But it's only supported by the fact, as Gabe has said, that we've got some really incredible delegates that are working very hard right now to get that case ready, making their witness statements be as beautiful as possible, working with those very smart barristers and lawyers to make sure that we have got the strongest case going forward. We wouldn't be here if it weren't for members on the ground who have been pushing this and campaigning now for years to get us to this point. We're at the final end. We can see the finish line and we're crossing everything that we get there.
Excellent. And it's important that we can walk and chew gum at the same time, because not only those matters going forward, also we've got the Ambulance Managers Award and also the Control Centre Award, which you've been involved with recently.
Yes, so we've got, again, very hopeful that we're at the finish line with both of those. We've got two different approaches. We're really, really hopeful that with the Control Centre award that we are at the point of finishing negotiations, but I know that members, delegates are still in discussions with health and ambulance about that. With our Ambulance Managers Award, we're preparing the strong case. We're using those same barristers and lawyers to prepare witness statements to put forward a case in the Commission later this year. I mean, these are changes that I know members are really invested in, and I believe health and ambulance are as well. We just have to get to a point where we resolve them.
Yeah, and that goes on to the point, Gabe, about the core conditions. Speaking of walking and chewing gum, this is a vitally important matter that has been outstanding for a long time. We're not far off the end game there.
Yeah, that's right. And members will have received lots and lots of text messages, Gerard, asking them to fill out the core conditions survey. It's a really important survey. So part of our claim is for all HSU members in New South Wales Health to have access to more sick leave and to have uninterrupted breaks. Because what we know is that while in theory people get breaks between shifts, oftentimes they're called back to work, they're kept late at work, they're called in early. People aren't getting the time they need to rest and recover. And we know that's really dangerous, not just for staff, but also for patients and the community. The other thing we know is that HSU members are exposed to a whole bunch of illness every day, but they have the same amount of sick leave as most other workers and less sick leave than a bunch of public servants. So what we're looking for, and I know people have got a lot of text, but take the time, we really need members to take the time to fill out that survey and talk about what is their experience with breaks between shifts, with interrupted meal breaks, with using up all of their sick leave. We need to hear from, all of our members, and particularly we need to hear from working parents who want to tell us about what is it like to try and juggle not just a job where you are exposed to illness and injury every day, but also, kids in childcare who are little germ factories. Like, how do you get all that done with only 2 weeks of sick leave a year? It's just not fair. So, yeah, members really need to keep an eye out for that survey link and fill it out so we get that evidence, and that can all go into the Commission in November.
And so, bouncing from sort of public health into the private area, you've both been dealing with the private-public partnership issues at Bathurst, at Orange, at the Mater and John Hunter, and obviously at Northern Beaches Hospital, which has been a great success. Do you want to tell us a bit about that?
Yeah.
Well, this is really one of the greatest examples of union members coming together and using their power for change. So if we look particularly at Northern Beaches, our incredible delegates and members there have been in this fight now for years and have never given up. They never gave up hope that public health should be provided by New South Wales Health. And their concerted efforts, we now can see that fantastically there's a new sign out the front of that hospital that says New South Wales Health, and our members within that hospital are now employed by New South Wales Health, and they're very, very proud of that. We're out at Orange and Bathurst and Bloomfield hospitals, in the last couple of days talking to members there who are still experiencing the issues of having private providers in public health. Fundamentally, there should be no profit ever in the provision of public health. It just is, it leads to bad outcomes for workers and bad outcomes for patients. And I know that our members there are still in the middle of that fight, and Gabe, they've got a bit of a plan about what happens next.
Yeah, they do. It's a really strong group of members out there who are just standing up and saying enough is enough. We're not going to have a large ASX-listed multinational pulling profit out of regional hospitals. So the guys are, standing up. We're midway through this campaign to try and get Downer out and to really hold the Downer Group accountable for where is the money going? Why aren't there enough staff? Why are staff treated badly on shift? So those guys are doing really great, as are the delegates in Newcastle who are fighting really hard around Calvary and have done that incredible job telling the community that Calvary Mater is not providing the level of healthcare that it should to that community. And regional communities deserve high quality healthcare. So we've got delegates doing amazing work. We know that both the work in Orange, Bathurst and Bloomfield with Downer is ongoing, and similarly at Calvary Mater, There's a lot of work there to ensure that that hospital is returned to public hands and that staff there are treated the same as their colleagues across the rest of the state, have the same entitlements as everyone else in New South Wales Health, and get to go to work somewhere that's not riddled with mould and disease. People deserve safe workplaces and patients deserve safe hospitals. So really, really important work happening on the ground and led by absolutely phenomenal union delegates.
And so it's really interesting, as opposed to delegates reacting, they're actually proactive now.
Yeah.
They're actually driving the agenda, which other organisations now have to respond to. And I think it's really important, pardon me, that we can talk a bit about aged care, which has come off the back of a 29% wage increase a couple of years ago. That's gone some way to attracting and retaining, but now it's sort of really developing the profession to take next steps in the future.
Yeah, absolutely. And our members in aged care, they're looking at that next phase. You know, we've done the big piece in terms of getting an uplift in wages, but now it's actually about recognising the work that they do. So it's about registration. It's about saying we are a profession that needs to be registered and we need to be recognised. It is about minimum qualifications in the sector, saying that if you provide care, you must be certified to be able to do that. But it's also about the broader issues in aged care that our delegates are now fighting. So there's this new funding piece that employers have brought out called HELF, HELF, that allows employers or organisations to charge residents for basic services that they say is an add-on. So instead of being able to get lemonade, you now have to pay for lemonade. Instead of getting ice cream after dinner, you've got to pay for ice cream after dinner. It's just a rort. And our members who have to go out to residents and say you're no longer allowed ice cream are just saying enough is enough. So when our members come together in aged care, as they've demonstrated through after the Royal Commission, it's not just about what happens to them and their wages, it's about the residents that they care for and having that big sector-wide fight. So it is something that we're going back out to members across the country now to say, what's happening with health? Why has the government allowed this to happen? We're saying it's not good enough. Residents should have the dignity of picking lemonade over orange juice and ice cream after dinner, and our members are going to say, we're not going to ask people to pay for more money for basic services.
Absolutely. And I think one of the last things at this point in time on the agenda is the paramedics. This year sees the last increase that goes to a 28% increase of recent years. But also we're looking at conditions at the moment too, so we'll have a bit more to say on those issues, but clearly building into 2027 to be able to re-engage on a wages area, but also at the same time looking at scope of practice and how we can professionalise further into the medical community. So, that is just about where we're at the moment. What's going to be really important over the next coming months is building into our conference. So the conference this year is going to be in September. You are very welcome to be attending if you've been elected, but also online, that we will be streaming it live. And it's going to be it's going to be about growth, it's going to be about communication, it's going to be about the vision of the future. This union has done a lot of work over the past 10 years, and we've achieved an incredible amount in the past 10 years. But it's about where to now, and this is your opportunity to be involved, whether you're at the conference or you contribute online. But your views, you go a long way to building what our agenda is and what our platform is. So we welcome you in the next couple of months to be involved in that, and thank you for your support, and we'll see you again very shortly. So.